name is Dr. Jylana Sheats, and as a Middle Tennessee native and current resident, I do want to welcome you to Nashville. I'm both excited and honored to moderate this important discussion on artificial intelligence, also known as AI. And as I mentioned earlier, I am the Associate Director of the Aspen Institute Science and Society Program. And our mission is to catalyze community leaders, current and future scientists, and the general public to build a better scientific ecosystem, society, and world. Our work navigates across 3 pillars: global science, public trust in science, and science and social justice. And so today's panel builds on our previous work around building and distributing equitable AI in our science and social justice pillar. And so we do have a report that we released in 2024. You all may have received it from Jasper. If not, I'll be sure to send out that resource as well. We have 2 powerhouses with us today: Mutale Nkonde, founder of AI for the People and visiting policy fellow at the Oxford Internet Institute, and Keeys, the director of the Federal Affairs of Hologic, Inc. And so one of the things that I think that you'll see over the course of the next several days is that many of the issues that we're talking about are connected. And just in hearing that presentation a moment ago, that really just emphasized it even more for me. And so one of the things that I wanted to share was this quote by Audre Lorde, and it says, "There is no such thing as a single issue struggle because we don't live single issue lives." And so as you hear the different workshops and presentations, I want that to resonate, okay? And so, and that kind of is a nice segue into what we'll be talking about today. So given the cross-cutting nature of AI, our goal today is to just start a conversation that will equip each of you with information to make informed decisions on AI-related policy with use cases in housing, labor, education, and healthcare sectors. And so while considering these sectors, emphasize the need to ensure that civil rights are not violated, existing anti-discrimination laws are adhered to, and that Black and brown people in our communities are protected. So with less than an hour, I ask that you think of this panel as the first of many meaningful discussions and learning experiences that will hopefully continue after today and the week. So Mutale and Mia will each provide remarks, and then we'll open the floor for questions. All right? So Mutale, I'll read your bio. Okay? So Mutale Nkonde is an AI policy advisor and founder and CEO of AI for the People, a nonprofit that seeks to use popular culture to increase support for policies to reduce algorithmic bias. Nkonde led the advocacy for introducing the Accountability Act to the U.S. House of Representatives in 2019 and testified to support the act to the House Commerce and Energy Committee when the act was reintroduced in 2022. In 2023, Nkonde was named one of the top 10 leading women in AI by NASDAQ and 2 Sigma Ventures, and one of the top 100 technologists to watch by Women Who Code. AI for the People is currently providing input for the forthcoming UN Declaration for the Rights of People of African Descent, in which they are advocating for freedom for algorithmic bias should be a basic human right. Nkonde is a member of the TikTok Content Moderation Advisory Board, a columnist for msmagazine.com, and a much sought-after speaker and media commentator. And I will say that we first became acquainted when she spoke on AI and algorithmic bias for the Aspen Institute, and so it's nice to be here where she can share with you all today.
Thank you so much for that kind introduction. I do have another bio, though, which is a little bit more updated, and it's 151 words, because I tell anybody, if you have a short bio, then people really know you, because Beyonce is Beyonce's bio. So with that said, I'm going to spend the next 10 minutes just level setting, because I think that there is I think that there is a conspiracy to make these issues feel more complicated than they actually are. And with my professor in the background, just in clarification, I haven't got my Ph.D. yet, but my professor is going to help me with that. So I am not quite a doctor. So my agenda is to introduce myself, to give just very top line what AI is, then talk about racial literacy in tech, which is a framework that I developed while I was at Harvard that really was meant as an engineering tool. I come from the product design world, and when we are designing tech products, we do a lot of this through checklists, and it really annoyed me that everybody in the design process was white, and nobody would admit that race was a factor. And I do need to, again, thank my professor in the back to help me think through what does it mean to make race visible, particularly when we're speaking about capitalism, which is something which is really what's driving AI at the moment. And then some very practical tips on how, as you all, as decision makers, can think about when you're being presented with these proposals, no matter what committees you sit on, what questions should you be asking? When does this look harmful to Black people, and what power and agency do you already have? So very quickly, advancing racial literacy in tech is kind of the thing that brought me to the party. One of my mentors back in New York is from Texas, and she always says, dance with the person that brung you. This is what brung me. And it was a 9-page report where we tried to make race visible for the engineering world. That led to something that I didn't know, and I don't think many Black people know, but the MacArthur and Ford Foundations basically came to me. I was in research at the time, gave me what I thought was a huge amount of money. Of course it wasn't, white people get more, but to start an organization where we would think about responsible AI as a public good, as something that the public sector and public sector decision makers should have access to. This was back in 2018. Nobody really believed us. The funding was small. Everybody believes us now. The funding is bigger. So again, as mentioned, we live in America. It's a capitalist system. It doesn't really exist unless capitalism recognizes you. I was very shocked when NASDAQ named me one of the top 10 women in AI, because I just written an article critiquing OpenAI back in March, saying that they were not putting Black thought leaders, Black philosophy, Black culture into their training data set. And so what we were gonna get was a biased product, and it's been really nice to see that article being reshared on social media yesterday as we look at the new OpenAI team. And for those who don't know, people like Larry Summers, who is famed economist who led Harvard and said that women could not do science, is now on that board. And that is a full white company, full white board, making products that are gonna change all of the lives of the people in this room. So it's something that we should be concerned about. As mentioned, I advise TikTok, which I'm happy to speak about, very controversial. That is a Chinese company operating in the US. So we've really had to think about what does data sovereignty look like? And that was, what does protecting Americans look like and their data? What does protecting American children look like? And what happens when those children happen to be Black? So one of the things that you'll hear in the AI world are all of these reports about what AI does. We are not being studied. I am part of a group of Black women that are studying how AI impacts Black communities, but that's another thing that I want you to think about as I go through my remarks. Google, very long time partner, fun fact, they fired me back in 2015 for saying that their algorithms were racist. They rehired me in 2020 when George Floyd got killed, so there goes God. So still working with them. And I have most recently, I mean, it was crazy. It was like, they didn't know no Black people. They knew me, they called me. And my most recent work has been with the AI Insight panels. So on the federal level, Schumer is in the process of developing what are gonna be the bones of federal policy. Kind of problematic. It's 4 white men, bipartisan, 2 Republican, 2 Democrat. I've worked with all of them because I've been doing federal policy now for 5 years, but there really does need to be Black voice and Black legislators in this. So I was very happy as I came in. I was getting some texts from my folks at the CBC. So on the federal level, they are now having, and we've been laughing about this, a meeting this afternoon at 2 to discuss a meeting about whether they should have a meeting to see whether AI should be in the agenda. So I hope that you are all congratulating yourselves for preempting the CBC. So very, very quickly, this isn't a great slide in terms of visuals. Oh God, I've gone way too forward. But when we speak about artificial intelligence, we're speaking about engineering processes by which machines can do things that people can also do. These are associated with higher level thinking. And the reason it's called intelligence is that it often is designed to take the human decision maker out of the process. There are three basic kinds. I'm not going to go too much into the science because this is not a science seminar. I just want you all as policymakers to know enough about what people are speaking about. So number one, we're speaking about decision-making machines. I can also share this if people are interested, because I know that that's not easy to see. So that might be, if you are working in social services, you might decide to get a computer to decide what kids are at risk. The computer comes in. The problem is the computer is optimized to often serve whoever the governor is. So when this happened in Illinois back in 2018, the computer system that was built was programmed to identify Black children as being higher at risk because of racist inputs. That led to a lot of poor white children dying because white parents, people living within particular zip codes, to go back to Color of Law, which is one of my favorite books, if you lived in a white zip code, you were coded as safe. And unfortunately, those kids were not safe, they died. There is a second type of AI, which is automated, slightly different from decision making, mostly used in labor, so it's to do very low-level tasks. So if we see from the actors and writers strike recently, acting in a scene was designated as low risk, low labor, because think about it, you're standing in a scene, you're probably not doing anything. And what they were proposing was to create AI versions of those people to stand in scenes and get rid of the humans. And in getting rid of the humans, that is obviously a labor issue. I come from New York City, I'm a labor city, we are a labor state. It wouldn't fly there, but I am in the South, which is right to work. Those same people may not have protections if we don't have federal guidelines around that. And then the last type of AI is generative. That's what everybody's speaking about in the news. What that basically means is that you could be at a computer, you can put in a prompt, the machine will then bring you an answer that is different to your prompt. As I said, my professor Hendricks is in the back. One of the projects that he and I are going to be working on in my thesis is looking at what happens when religious speech or when religious symbols are put into these prompts. And what comes out is white supremacy. So if we look at a lot of racial violence, it's because people are on AI systems using their social media, and you're getting these outputs. I can definitely speak about that later. I know that's very high level, but it's those three basic things. Knowing that we now have these machines that can make decisions, whether it's if you get a job, whether it's if your kids get taken away, whether it's even if you go to jail. One of the things with the recent White House executive order was that it made algorithmic bias something that we didn't want, right? That was gonna be a national priority. The very next clause made a criminal justice exception. So that meant if you are in the criminal legal system and they're using AI decision making, they wanted to make that fair. And people like me would say, how can we make a system seated in slavery more fair by using machines? We can't. So in order to have racial literacy, you have to also think about how we're often given something with one hand and it's taken away from with the other. And I think the decision makers in this room are really sure that those types of policies are not allowed on the federal level, that they're not, because they're not tolerated by the states. So the framework that we developed has three different elements I've just described. One, cognitively, the AI systems are built in society. Most of them are actually built in California, which is the United States. The United States is a capitalist, white supremacist government. That's how we have developed our base. So what comes out of that are going to be those norms. I don't know if you're going to cut that out of the video. That's just facts. You can cut it out though. I'm from research. We just look at facts. The second part of that is that that's a very emotional discussion to have. So it's very easy for me to make that statement. But as you can imagine, I work with mostly people at the VP level and above in major engineering firms in Silicon Valley who see themselves as good people. And so you have to have a way, and I love that there was a question around bipartisanship before. The way that I successfully speak to Republicans about this is I make it about privacy. I don't make it about race. But in making it about privacy, really put out this idea that Black people have never really had privacy in this country. So to protect us and look at how we are impacted by these machines, we are also protecting the rest of society. And that's just some Black feminist theory. Yes. And then the last part is an action plan. So one of the things that we thought about in this literacy framework was, even if we know that the problem, that these systems have racial bias, we know that there have to be very particular ways that we speak about them so that we don't get into emotional triggers. What's the action plan? And the action plan that I'm setting forth for you is that Black policymakers at every level, I do not care if you are on a school board and 3 people voted for you, if there is AI in your education system, you should be empowered with the information to make rights-respecting decisions. What I'm advocating for is this idea of impact assessment. So for my lawyers in the room, particularly my voters' rights lawyers, they'll know that when the Voting Rights Act was initially negotiated, one of the clauses was, in there's been historical voting irregularities, we're gonna have specific oversight. That's an impact assessment. What it looks like in engineering terms is that we will assess what is high risk. So if AI is used across every single thing, we need to assess, and what you need to assess when you see these proposals is, how does this impact Black people? Is it stopping us from getting housing? Is it stopping us accessing education? Is it in the criminal legal system? Are we now having environmental plants built by robots? What does that mean? What does it mean for labor? And the reason that I will stop at labor for a second is that McKinsey did a report in 2021 that found that Black people are concentrated in the South in industries that are dying. AI and a lot of these decisions are concentrated in the North, and proximity to those job markets means entry to the labor force. So you need, as these new factories are coming in, as the Amazons, y'all need to be thinking about, what does that mean for workers in your jurisdictions? The next thing with impact assessment is you have to demand, as policymakers, that deciding the civil rights impact of any technology that comes across your desk should be a question, and I promise you they will not know. And what you will say is that it should be in the product design process. I can give you a fact sheet. Actually means they will be very scared of you. They will wonder who you are, who sent you, why you're here. But if you ask that question, you will stop some very horrible decisions being made. The third thing is establish liability. So one of the things that I've been working on over the last couple of months is, how do we make people accountable? In the United Kingdom, they have just passed a law around social media where people that make social media products that harm children become criminally liable. That would never pass in the United States. That would never pass. We believe in work, we believe in working hard, we believe in making money. We wouldn't do that, but that's a model. So as you're saying these should be rights respecting, you should also be looking at, what does that mean legally? What fines are not gonna do it here, because that's not how the AI system works. We all know that Amazon was not profitable for 20 years because they were pursuing scale. My thing would be to deny market access. That has won me no friends in DC, but I say that you should not be allowed to make money from us if you are harming us, and I would advise you to have a similar stance. And then the fourth thing is, what are no-go decisions? If you have something that could be weaponized, if you have something, and what I mean by weaponized are actual weapons. There is an episode of Abbott's Elementary where they introduce an education tech thing, and they find that the data that the kids are putting in are being sold to the prison system to figure out which kids can't read. That is fiction. That is not really true. But what that episode did was say, we have data brokers in this country that sell our information from one place to the other. We do not control that sale. You should be able to say it is a no-go if this information could be sold and then weaponized against Black communities. I used this picture is that I think the civil rights movement was an amazing thing. I enjoyed the speeches, I liked the music. As a Black person from the diaspora, it made me look up to American and American Blacks, but you know why it was effective? Legislation. We can't march, sing, and plead our way into freedom. We need to legislate. So if something comes across your desk, you should ask these 3 questions. Does this proposal comply with this existing non-discrimination law? You are asking this to not do anything special, but just to abide by the laws of the land as they stand. Does this proposal impact my vertical? People think of AI. Oh, AI. But what you should be thinking about is, well, I'm on the automotive industry oversight panel. Do you know that if you drive a Tesla, it really doesn't stop when you see Black people because the computer vision isn't good? I drive a Tesla. I never put that thing in autopilot because I would kill myself, my children, people that look like me. People don't realize this. Many of these technologies are half-baked. They do not work. They are not tested on us. So you should be aware of that and ask that question. And then the final question in terms of my call to action is, how will this oversight be funded and managed? Where you sit, in your spheres of influence, do you have the budget to hire people like us on this panel to come in and help you think through that? Are these being earmarked? The executive order is a beautiful thing, the White House executive order on AI, but it's a bunch of suggestions with no earmarks because it has not gone through Congress. So it is great to say that we shouldn't discriminate, but if we don't have the people on board to really do that work, then we need to, you all need to be advocating for that. And then as somebody that has come out of research, you all need to be advocates for public school education. You all need to be advocates for community colleges, and you all need to be advocates for academic freedom in the academy, because I would not be able to do this work if I did not have professors that could teach about race. And we are living in a country where the attack on teaching about race is real. If that becomes federal policy, not only would I not be able to do my work, but you all would not be able to get this information. So this idea that we need to think in joint up ways, there is no way for this presentation if there hasn't been at least 25 years worth of educational investment in me as an individual, and then it's my job to invest the next generation, and I'm not gonna be able to do that if I cannot talk about race publicly. So this definitely was a presentation about AI, but I really hope that you see that what we're really speaking about is decision-making and making sure that civil rights continues to be part of the decision-making conversation. Thank you.
Take one question now, but we're going to take most of them at the end, so if you have them, then please write them down.
Thank you for your indulgence. So I appreciated that last presentation. In case y'all, so Florida has become the petri dish for a lot of foolishness that goes to dismantle civil rights protections that we fought for, whether you're talking about employment, education, et cetera. We see that with this whole concept which has spread throughout the country about anti-wokeness, right? I'm not even gonna get into all those details, but looking into there, and if you wouldn't mind, can we go back to your last slide, the one right before this one? Okay, right here. So my question for you is, as we're making these assessments, because my background is in employment discrimination and impact litigation, so I'm always looking at impacts in every space. So when we talk about insisting as legislators, as policymakers, or in whatever role we are, in the product design strategy, you mentioned you had a fact sheet, but what does, like, break that down, what that looks like. What are we insisting on in terms of if we're putting in policies in our various states, when we're on that little piece right there, the product design strategy, what does that need to be? And then when we talk about establishing liability, what does that liability need to look like? The example you gave was terrifying to me as a lawyer, because even right now when we're seeing what's going on in Palestine and how people are weaponizing that in social media, and in my state, and people are starting to put things for criminalization, which we know is always disproportionately impacting people of color and not applied in the same way. So how do we come up with something that gives the accountability that you're looking for with the criminalization without exposing us with, as they do with all things in criminal justice in this country and all white supremacist countries, in a way that protects us without harming us?
I'll be quick because I'm excited about your remarks. I don't want to take too much of your time. In terms of, I'll start with product design. You should just be asking for three things. Whenever we design a product, there is something called the testing and evaluation stage. And that's after you have designed whatever thing, we're supposed to, as engineers, then say, does it work? We're not doing that. That's a very expensive phase. And so one of the things that I always say is, you should know, what is the testing and evaluation metrics? How are you measuring impact at that testing and evaluation stage? And what is your baseline? So I was speaking to Microsoft over the summer. They said to me, we, at the testing phase, our impact was 90% better than the time before. And I said, 90% of what? And they couldn't tell me. And then they were like, it works better on 90% of people. And I said, which people? And as I drilled down, they had asked 3 people. And it just worked better on those, it worked better on John, Bob, and Paul than it did on Sally, Harry, and Barry. I don't care about Sally, Harry, Barry, John, Bob, or Paul. No one here is Jamaica, no one here is Tamika, no one here is Mutale. Go get away with me with that. So you really need to figure out what their metrics have been, and then they need to come back to you. Better than that, on the federal level, I've actually laid out what real testing should look like and what real impact should look like. And my gold star is that if it discriminates against any protected class, that technology is not ready for prime time and should not be released to the market. And I'm putting incredible pressure on the federal level for an FDA type thing for algorithmic actors, because we wouldn't just put any type of food into our food system. In terms of liability, the way that I think about liability is governance priority. So we probably are not going to want impact assessments on AI products that are making artificial hearts beat more efficiently, right? I think that we could potentially agree that that's an area that would have governance, but it wouldn't be as high priority as a decision-making system is deciding whether your kid is ready to read or not, because we all know whose kids are not going to be ready at whatever time, right? And once you've then put priority in, I then ask, what is going to be the long-term impact on this person's life, on this decision across generations? And I'm really unpopular for this, because what I'm pushing people to think about isn't just discrimination in the first person, but legacies of discrimination, which goes back to the color of law. I'm sorry I keep pointing you out, but it goes back to the color of law, because if you listen or read that book, it's talking about housing discrimination, in Jim Crow and what that means for communities today. And we need to have this conversation about legacy of product. And then that goes to the third thing when I was speaking about my newest research interest, which is religious speech and online. If we look at a lot of dis and misinformation around voting and what's pushing Black communities out of voting, and if you look at things like January 6th, those jokers prayed in the Capitol after they stormed it because they said that QAnon was Jesus, and no, 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 no. You know, something has gone desperately wrong. So if we're gonna have, going back to liability, something that is gonna disrupt this democracy, you probably don't want that system in the marketplace. If it's gonna have, Broward County, Florida, y'all were using an AI system for bail determinations. The machine was sentencing Black defendants to much harsher sentences than white. Not the people, the machine. That is something that needs to be looked at very seriously, and liability should look at the impact on the person's life and then trying to remedy that. Again, I have not been popular because I'm speaking about reparations, I'm speaking about preempting racial violence, I'm also speaking about slowing down capitalism, because what I'm saying is that not all money is, that you as legislators need to be brave and bold in that. Because, and then the last thing I'll say is, if your colleagues come back to you on the right and say that you are slowing down innovation, if you look to organizational psychology, regulation is part of the innovation cycle. Regulation gets your product into people's hands safely. If you want to make $1 billion, go and do it, but do it in a way that is rights respecting. And I've always had to remind my colleagues on the right that we are trying to make you do this the right way, not just do this.
All right, excellent and great question. So now I'd love to introduce Mia Keeys. She's a writer, researcher, and speaker on topics involving health equity, congressional health policy, women's health, and health innovations and artificial intelligence. As I mentioned earlier, she's the director of the Federal Affairs at Hologic, Inc., a women's health and innovation company, and was formerly the chief of staff and health policy advisor to Congresswoman Robin L. Kelly. Mia also previously served as the inaugural director of the Health Equity Policy and Advocacy of the American Medical Association. She's been celebrated and recognized in numerous ways. For example, she was recognized as by the National Minority Quality Forum as the 40 Under 40 leader in minority health. She has been a Kaiser Family Foundation Barbara Jordan Health Policy Scholar and a fellow for the City of Philadelphia in the Deputy Mayor's Office for Health and Opportunity. She's also been a U.S. Fulbright Fellow, among other accolades. She has degrees in English and psychology, as well as medical sociology from Cheney University and Vanderbilt University, and is currently a doctoral candidate at the Milken Institute School of Public Health at the George Washington University. She's originally from Philadelphia, Pennsylvania, calls Washington, D.C. home, and is the mother to one son. I'm excited to welcome you here today.
Okay, very good to know. Thank you. I'd be remiss if I didn't also say I attended Meharry Medical College as well. So all the, got to keep it cultural for sure. But I think what Mutale laid out for us all today, I'm sure it will generate additional questions. What I'm going to do is just repeat a good number of some things that she mentioned and specify that work in the healthcare space. I primarily come from this conversation with respect to healthcare and health policy. And when I talk about healthcare, I'm specifically in this conversation talking about clinical medicine, but more broadly talking also about public health. So let me also say, I know she's not here, but thank you to Leader Camper, who just opened up with her legacy and her work that she's been doing with the extended leadership here. And I'm really excited for everyone's curiosity, for your engagement, and also for your stories, because you come to the work that you do for various reasons, whether it be trauma, I imagine, as you and others have shared, just inspiration. And so I'm hoping that this will, at least on my part, be just an opening in terms of conversation with all of you in some capacity. And of course, I'm excited to be here with the two of you, and thank you for your gracious moderation and also for your work and the way that you really bring it to the folk. So what is AI? And we saw this here. AI is essentially, as Mutale mentioned, it's smart technology, it's machinery, it's algorithms, and we'll talk very briefly about what algorithms mean. It's all of these enhanced formula in a way that helps to enhance decision making, but also resource deployment, and it mimics human rationale overall. And when we're talking about AI, we're thinking essentially that ideally it should make processes faster, it should make them more accurate, more ubiquitous, and certainly more efficient than just having the human involved. And when we're looking at, especially in a world that's growing rapidly, in a nation that's growing rapidly, having additional inputs should, ideally, on the face, enhance the way that people are able to benefit from the outputs of these technologies. I'm also going to be talking, and we haven't so much used the word today, but essentially we are discussing equity. And what I mean by equity, okay, what I mean by equity is essentially the tenet that underscores that everyone receives what it is that they need, which is a philosophy that's a lot different than equality, right? So you likely engage in conversations with people across the political barometer, and you hear a lot of people say equity, you hear a lot of people say equality, and they think they're talking about the same thing, right? Or at least the people who are using it for equality think they're talking about the same thing. But if you were to think about it, equity is really just, or excuse me, equality is really the tenet that says everyone gets the same thing, right? That's fairness, right? Whereas equity says everyone receives what they need. That's justice. It's a very different application, especially when we're talking about entering into conversations where the social context, really, or excuse me, social institutional context truly matters and is unique in the United States. Okay. And so the thing about using equity, excuse me, equality versus, I see you coming with that microphone. Thank you, ma'am. Thank you, Ms. Dunn. Okay. So, when we're talking about using deliberate language, equity, and equality, I just want to make sure before you leave this room, you just double down on the fact that you will only use the word equity when you're talking about the policies that you yourselves are championing, and challenge anyone to be a lot more deliberate and on point with their language when they're using equality, because it literally does not mean the same thing, right? Especially when our needs are different. And so the other thing that I'll say that's important about a tenet of equity, particularly in this conversation, but in all the conversations you'll have, it's not a zero-sum type of game, right? So when you're talking about applying an equitable framework to works, to policies, it doesn't just implicate or benefit the intended population, right? So Mutale talked about protected class statuses. I can offer you probably one of the most equitable policies that all of us benefit from today, and it's the Americans with Disabilities Act. Right, and I'll tell you why that's probably one of the most equitable policies that you'll ever encounter as an American or someone who just steps on U.S. soil. The ADA, I used to work for a gentleman named Tom Harkin from Iowa. It was my first job out of college. He was a senior senator from Iowa, and he was the author of the ADA. And that's when I first learned about equitable policy, even though it wasn't termed that. But essentially, that policy was just celebrated a serious milestone just a month ago, and it was commemorated through the Biden administration. Essentially, the ADA is responsible for the fact that you could have taken the steps to get into the Frist today, or you could have taken the ramp up to get into the Frist today. And if it had not been for the ADA, those who are disabled would likely not be able to enter, or would certainly have a major capacity issue with coming in. So when we're talking about equitable policy in this case, we're talking about that looks specifically at the needs of a historically marginalized or underserved community, but ensuring that not only does it help to benefit that community, but it will ultimately work for other people. And as a new mother who pushes a stroller everywhere, I am very grateful for a ramp up into most places, right? although, that wouldn't completely keep me, but it's necessary. So why do I break it down in that way, talking about what AI is specifically, which is very simple machinery that mimics human rationale, and what is equity? Because I want to help you all walk away with just 4 answers to 4 questions. And the first one has to do with what is AI in healthcare, because that's primarily what I look at. What is equitable AI in healthcare? What is inequitable AI in healthcare, and how can you as policymakers, as legislators, work toward the promotion of equitable AI and be mindful that your policies don't even inadvertently champion inequitable outcomes within AI? Okay, so we've got those 4 questions. Bear with me while I roll through my notes. Okay, so what is AI in healthcare? So AI in healthcare, as in most situations, really enhances the opportunity of earlier disease prevention, of earlier disease detection. It streamlines treatment of disease, but it also works to better coordinate post-monitoring of patients and patient outcomes. And you've likely seen this in your own encounters within the healthcare system, right? You might receive automated phone calls after you've been dismissed from hospitals. Have you taken your medication today? Or maybe you just have a very simple inpatient procedure and you get an automated text message. Do you need anything? Click yes or no, or send wire in if you're talking about smartphone technology, right? But this isn't just what you see with AI in healthcare in the clinical sense. You also see it in terms of non-clinical bounded delivery care. So it'll implicate the inpatient process, intake process, which often these days happens before you come into an office. So you might get a text message from your dentist, from your doctor to say, please fill out this update this HIPAA form before you come into the office. And it saves however amount of time before you get into the office, right? So you don't have to sit there and do that once you are waiting for that precious time with your provider. But then you also see that on the back end in terms of, like I said, what needs still need to be met, or when what barriers keep you from attending to multiple appointments that you need for your own care and for maybe especially care of your family members. So for instance, if you are working with an elder who you mentioned that your mother wasn't receiving dialysis in the way that she needed to because of power outages. So AI in healthcare, a potential non-clinical but necessary resource deployment would be, do you have what you need in terms of electricity? Do you have transportation to and from the healthcare provider's space? Those are also really very significant examples of what AI in healthcare looks like in terms of workflow processes, not just what happens within the traditional walls of clinical medicine. Mostly AI in healthcare accomplishes its output or its benefit related in the same way that Mutale mentioned, which is either in assistive ways or in semi-autonomous ways. So that essentially just means there is someone who is overseeing the decision-making tree of that particular technology, right? It is not, and therefore decisions around care are not just made absent of a provider, which is a highly unique space in a conversation that's mostly about generative AI. You hear a lot of that today. But the thing about the healthcare system here in the US, and you know this, it's a highly regulated space. And there are 2 entities in particular that are significant for the regulation of medicine in general, but specifically AI, and especially when we're talking about equitable AI. We're looking at the Food and Drug Administration, FDA, and we're looking at the Centers for Medicare and Medicaid Services, the CMS. So FDA approves medical devices, approves software as medicine, right? That's the takeaway. CMS pays for medical devices, pays for software as medicine, or it doesn't, right? And that matters in terms of when we're talking about the equitable outcomes associated with using AI in healthcare. We seldom will see the use of that other type of AI that was spoken about earlier, autonomous AI. And I must say, I walk the line very clearly, and as you all are working with your constituents, particularly your medical constituents, your physicians, your nurses, you want to be mindful about what does it mean to produce policies that take that they will essentially hear you say, take the provider out of the process, right? You will not see very soon, I don't want to say if at all, but very soon you will not see FDA approve autonomous AI for healthcare, right? And that's essentially because to take the provider out, it's a political decision. I'm not saying by doing so, it would promote or enhance or really take away from outcomes, but it's just such a political decision. I used to work, as Dr. Sheats mentioned, I used to work for the American Medical Association. It is the second most powerful lobbying body in the nation, huge dollars. If there was a law that said autonomous AI needs a greater applications within healthcare, I promise you it would be shut down within an hour because AMA would see to it and other like bodies. So you will likely only see conversations about assistive technology in healthcare or autonomous, or excuse me, or semi-autonomous or just enhancements, but not necessarily autonomous discussions around AI in healthcare. Okay, so I do just want to give brief examples of healthcare AI in terms of existence. I'll just give one, actually. So I work primarily right now in women's health and most namely in the cancer space. And so in cancer, imaging has used for a very long time, almost 25 years as of last month, or this month, what's called computer-assisted detection, or CAD. CAD is, as I mentioned, a quarter of a century old, and it's used in imaging to just enhance the way that radiologists in particular can look at tissue, and namely breast tissue. And so without it, products like 3D mammograms or mammography would not exist today. And in the cancer space, many a person's life has been saved by the fact that most mammograms today are not 2D, they are 3D. So you can see deeper into the tissue, and so on and so forth. There's actually even recently a bill that's been signed into law that in addition to providers needing to be able to provide the best care, patients need to know how dense their breast tissue is, which implicates mammography, and it really just puts AI in the healthcare space, especially in cancer, on notice. Like, you need to make sure that people are getting this right, especially for persons with dense breasts. And Black women, we tend to have the most dense breast tissue. All right, so let's keep that in mind too. All right, so I'm going to move on to this next question, because this is the thing. All of the benefits that come out of AI in healthcare, it doesn't matter, especially if you're talking about, this is the smartest technology and innovation in the world, but it can't help in a healthcare marketplace that does not necessarily value everyone as a viable end user, as a sustainable or paying customer, right, or beneficiary. And these applications don't matter at a time really where health providers are not financially incentivized to use the best innovations in care, especially, again, if you're talking about providers who service patients who are under public insurance, right? Which is important, again, going back to the thing that equity is not a zero-sum game. Medicare and Medicaid, it not only does it serve those who are economically under the vulnerable and indigent, as historically 1965 legislation mentioned, but it sets the tone for private insurers. It sets the tone. So if CMS is not paying for a product, then private insurers are likely not going to do it. So that matters especially to all of us, I imagine, who are here, who are not under Medicare and Medicaid, but you are private insurees. And again, if your company is not necessarily incentivized to pay for its providers to use this medicine, that means a whole swath of folk go bereft of the most high-tech quality care. All right, so I don't even have to spell that out in terms of what that means in terms of these, for whom you're working. So, I know we're coming short on time, and I just want to very briefly mention some other things. So when you're looking at what exactly is equitable healthcare, you want to make note that it's several things, right? It certainly makes resource deployment faster, more accurate, it's more ubiquitous, it's better and best for all patients, irrespective of, as well as inclusive of socio-demographic and intersectional identities. It provides clean and clear pathways for providers, right? So it is paid for, right? Just out, it has to be paid for. If it's not paid for, it's not going to work. And it's only paid for if it's approved by FDA, okay? Which is a slow process. So let's just be very clear there. It's an extremely slow process. And especially when we're talking about crisis crises such as like Kay Matthews is in the room. She does a lot of work, obviously, in maternal health. A lot of what the smart apps that are coming out to really provide care for those who are, experiencing maternal health distresses are not paid for by FDA by CMS because they're not covered by FDA. And so what does that mean when those who are historically going without care, who are in need of something different, more equitable services are not being recognized, their innovators are not being recognized in the traditional payment canon, in the traditional federal canon, it matters because those applications are not necessarily sustainable unless they have private funding consistently, right? So we can talk about more of that later if you'd like. But equitable AI is distinguished by highly inclusive data, right? So this means that you have diverse candidates who are in clinical trials, not just, and I want to go back to being deliberate about language. Don't let people around you just say diverse, diverse, diverse. Ask them to be mindful and name what type of diversity are you talking about. You're talking about racial diversity? Absolutely in clinical trials. We're talking about gender, we're talking about age, we're talking about geographic location, and you have to be able to name it. But the thing is, if we're talking about race, our people are not in the clinical trials. And it doesn't matter how much privilege you have or how much money you have, those applications are not built with your lived experience in mind, right? And it's not because folk aren't good people, it's because we're just not at the table. It's not even at this point because we don't want to be within clinical trials. It has to probably do with the trustworthiness of the institution. There are a couple other things that I would want to say, but I really want to be mindful of everyone's stomach. But let me just briefly say what inequitable AI does not look like, or excuse me, what inequitable AI does look like. It's powered by poor algorithms, so it's not representative. Our people are not at the table in terms of design, and it reinforces bias, it drives job displacement, it increases output of misinformation and disinformation, and these are words that you hear, nouns that you hear in the media writ large, right? So that certainly matters. It's even destructive on the reputation and morale of healthcare providers. And this is the reason why, because AI in healthcare, the end users immediately are not patients. The upstream users are physicians, nurses, midwives. It's those who are essentially parlaying the technology for the benefit of their patient population. And so as legislators, you've got to keep that in mind, that probably the first people to come to you to talk about AI, they're going to be providers. And you need to be sensitive to what it is that they're doing. So essentially, and I would want to talk about, I have literally 1,000,000,001 examples of AI that has been approved by the FDA, but has been extremely harmful to Black people. And I'll just give one example because I'm so sensitive to this as a mother. How many of you have had children? How many of you in birthing children have had a C-section? Okay. So there is something called a VBAC calculator, and you've likely have heard of this. The VBAC calculator is something that obstetricians use to essentially help them decide whether a woman or a birthing person should have an emergency C-section after they've had, or should have a vaginal birth after they've had a C-section. And so the thing is, it's a highly instructive and useful tool, but it discriminates against Blacks and Latinas because it provides, the output is essentially saying that Blacks and Latinas are at higher risk of, in terms of being a liable patient, and therefore they should have a C-section as opposed to give birth vaginally. I had an emergency C-section, it was my first, so that the VBAC doesn't necessarily apply to me, but it applies to me in the sense that I hope to have additional children. I have sisters and people in my life who want to give birth in a really healthy way, irrespective of how that happens, but the decision shouldn't come down to a tool that was not designed with them in the process. And the last thing I'll say about that part is, so it was mentioned that I worked for Robin Kelly, and I see a number of Illinois folk here. If you don't know Robin Kelly as an Illinois-based legislator, please see me later. I can connect you. But I served as her health policy advisor and also her chief of staff for a number of years. Robin Kelly runs the Health Brain Trust for the Congressional Black Caucus. What that means is she provides, and as an extension, I provided advice to members of Congress, to the CBC, to say, this is the policy in terms of health that you need to pay attention to, and this is why. When it came to maternal health in 2017, there was no policy around maternal health, not one. Ms. Kelly and I authored the first the first policy in all of congressional history for maternal health, the first comprehensive policy, and that was my first baby. And when we were doing that, I was certainly thinking about, as much as I could, what futuristic type of things needed to come in place in terms of ensuring more equitable outcomes for Black and brown women. So in closing, what I'll say is that, you know, what you can do is certainly continue to ask your questions, continue to be curious and critical. I think the fact that you're here says that much. Just bring it back with you. I have a ton of books that I can tell you to read. A number of you were talking about color of law, but the thing about health policy and equitable health AI, it all relates to health. Is more of an access issue. You can't have this, yeah, absolutely. You can't have this conversation without talking about transportation. And in this case, equitable health policy is health policy, and equitable AI policy has to do with health. And everything that you all are working on today, environmental justice, and you are doing the right and appropriate and timely thing. I'm so very proud of you, and I hope that you all just keep up with the work and keep me involved. Thank you.
Thank you. So we have time for like 1 or 2 questions. So we'll start here, right here.
Okay, so medical racism exists, and within, how do we make sure that that does not get implemented in AI?
So the first thing I'll say is, I love how straightforward the question is. We all have bias. We all have bias. When we lead with it in an unconscious way, that's the harmful part, right? But that's bias. Racism is wholly different, right? And when it's systemic, as you already know, it takes consistent digs at it, which first and foremost is an exhausting process. But how do you then get at medical racism? First and foremost, you have to bring the players to the table who have historically and institutionally been a part of building up a system that does not work well for those who have not been beneficiaries of health policies, right? So that's first and foremost, again, the American Medical Association. I call them out, and I can do that because I worked for, I helped to build up the Center for Health Equity, and that was essentially what it was about, getting physicians to say after almost 200 years, now you can say racism is a public health threat. It took almost 200 years to say that. So, but now the institution has to say that, but now they have to put their money where their mouth is, which is, well, how do you then work with future physicians to ensure that their medical education is really instructive, not just of the histories of medical racism, right? But then also, how do you help them to then reconstruct what they're learning, which is, it implicates their textbooks, and their textbook learning implicates who they bring to the table in terms of their teachers. But the bias part, I don't think we need to throw bias out necessarily. And let me explain what I mean by that. If you throw out, especially and I'll use algorithmic terms, because in AI, machines learn by data and input, right? And so without the data and input, or recognition of the data and input, it's almost like, oh, well, there's nothing there, so we don't even have to talk about it, right? We don't have to talk about the history of bias in healthcare. It's the same even in the inputs of people, right? There are algorithms that have to do with the way that we folk to become physicians and providers just in general. I'm saying physicians a lot, but I'm mostly because I'm putting the onus on them in a lot of ways. But the inputs have to match the desired output. And it's not necessarily to forget about bias. It's to, in the words of Dr. Khadija Ferryman, she's from Johns Hopkins, look at bias as an artifact in an instructive way, so that we can break down tenets of racism, especially as it's expressed in medical institutions, and that looks at the leadership of the institutions, that looks also at the pipeline of those who are coming in. So I feel like there's a larger conversation to be had, but that's primarily.
Absolutely, because when you talk about data sets, people can start using references, and sometimes when you're dealing with environmental induced diseases, you need patient-centered healthcare and not data set references.
So Mutale, did you have a comment?
Very quick.
Okay, then.
To make sure that we, testing and evaluation, you need impact assessment. There is absolutely, the way that you're speaking about designing products is not how products are designed in Silicon Valley right now in terms of patient-centeredness. So I think the best remedy for that are laws that require impact assessment. And if you're looking at a healthcare application, looking at how will this health application impact protected groups? Because just saying be fair is not it.
All right. One more. Okay.
And then also, just to remind everyone that we're recording this, and this is actually our first conversations, around this. And so we're going to be announcing webinars, going forward. So once legislative session starts, once you get settled, like we're still going to have these experts available to help guide you through these as you're in your lawmaking processes. So please don't, so just if you can't get a question answered now, just know this isn't the end. This is just the beginning. So, yes.
Thank you. Thank you both for your presentation. It's opened my eyes to a lot of different things. In Illinois, we're dealing with blacks dying at an alarming rate. That's probably across the country. So as the chair of the Probes Health and Human Services, I call myself the $1 billion girl because that's the largest budget within the House of Representatives. However, what I'm realizing is the health plans that, let's say, commercial and even Medicaid are not designed for our better health. So as we talk about AI, as we talk about access, as we talk about equitable, our little task force is looking at a health insurance plan for Black people that addresses our issues, environmental injustice, disparities, and so on. Is this a conversation? Have you ever heard a conversation like this? And
Often, not specific to AI, but specific to looking at the roles of insurance in terms of health outcomes. And I mentioned the NMQF specifically because they also have huge swaths of data that they cull from, and they bring into partnership during those conversations the CEOs of major health plans. So I know for a fact that the CEO of Blue Cross Blue Shield, which is so very Chicago specific anyhow, and sits in Illinois, the Blues of Illinois, they are attentive to the conversation. I don't want to say that they always agree, but they are attentive to the conversation, and I've witnessed them consistently there to work things out. Centene is another organization that I'll call out, another insurance company that I'll call out. Centene can be controversial in various ways, but they come to the table. Mostly, I think, because they know that if they don't, then this is the thing for all insurance companies, money will be lost. But besides that, I really do believe that there is hope and a strategy that can be found and worked on by bringing all of these persons to the too, because I know for sure that they partner with the National Minority Equality Forum, which has major trust and credibility amongst local communities.
All right. Thank you, Mia and Mutale. Your insights were amazing. There's, I'm sure, lots of questions. I know they'll be around for at least another